My name's Grant. I'm a postdoctoral researcher in Kathy's group at the University of Edinburgh. And today I'll be sharing some data that I collected during my PhD on a mouse model of EEF1A2 syndrome, which I developed. So just briefly, how can mice help with research into EEF1A2? So our main overarching aims, or one of them, is to understand the pathological mechanisms of these mutations so that we can design appropriate therapies. So one of the big questions is whether they operate through loss of function, gain of function, or both. And we also want to develop disease models so that we can test those therapies. And mice can help us with both of these. So just like humans, mice have an EEF1A2 gene, which is used in the same cells as in humans. Mice can also have many of the same seizure types that are seen in humans, and they also have correlates of human neurodevelopmental disorders. So for example, you can have mice with difficulties in learning and memory. And we can also compare the phenotypes of mice carrying the missense mutations to mice which have no mutation, no EEF1A2 at all, to sort of see whether the missense mutations behave like mutations where there's no EEF1A2, which lets us see whether they operate as loss of function. So I had to first choose a mutation to model in mice, and I selected mutation E122K as it was the most commonly identified at the time and still is, and it also has a consistently severe presentation in patients. There are 11 published cases of the E122K mutation at the minute, and these patients show motor abnormalities, so delayed psychomotor development. 4 are non-ambulatory, which means that they don't walk, and 6 patients show hypotonia or low muscle tone. All the patients have epilepsy, with a typical onset in the first years of life, but often the first months, and they show a diverse range of seizure types with variable seizure control. All these patients also have moderate to severe intellectual disability. They're typically non-verbal, and autism is also common. So I used a tool called CRISPR-Cas9 to introduce the E122K mutation into mice. And this here is a Western blot showing the EEF1A2 protein. And in the first 3 lanes, or the first 3 green bands, you can see the wild-type protein. Then we have the protein where the one copy of the gene has been changed to E122K. And in the next 3 lanes where both copies of the gene have been changed to E122K. And that's just to show you that the E122K mutation doesn't cause the protein to disappear or change in size. It's still detectable in the brain. The first main question was whether mice carrying the E122K mutation show motor abnormalities, such as are seen in patients. So I used a simple scoring system called the neuroscore to do this. So in this, we simply look at the animal's gait or the quality of its movement. We check hind limb muscle tone. We score their ability to walk along the ledge, and we check for abnormal curvature of the spine. And this gives us the neuroscore. And what's important to know about this score is that a higher score is worse. So here in this graph, I've plotted the neuroscore of wild-type mice from 14 days of age through to 28 days of age. And you can see they start with a moderate neuroscore of around 3 or 4, which quickly drops to 0 as the mice develop and learn the various tasks of the neuroscore. Next, here in blue, I've got mice which have no EEF1A2 at all. Now, you remember that Heather mentioned that EEF1A2 is essential for life. And what you can see is that these mice start off with a score that's similar to wild type, but around 3 weeks of age, the score goes up and up and up as the mice begin to deteriorate due to missing EEF1A2 neurons. Lastly, here in pink, I have mice which have only E122K EEF1A2, and you'll see that they start off with a higher score than all the other mice, but then they go on to outlive the nulls, and they die by about 4 weeks of age. So what does this picture tell us? Well, we can see that mice with E122K mutation have worse motor function than wild type. Their score is higher, which means that they do have motor abnormalities similar to those seen in patients. We also see that mice with E122K EEF1A2 live for longer than mice with no EEF1A2 at all. And this tells us that E122K does not cause complete loss of function. And then lastly, we can see that mice are better off having no EEF1A2 at all than they are having E122K. So this pink line is higher than the blue line at first. And this tells us that E122K is toxic in some way, causing a gain of function. The next big question we had was whether mice carrying E122K have seizures that are such as are seen in patients. It's first of all important to say that we didn't notice any seizures when we were just studying the mice or observing the mice, But as Kathy mentioned, seizures in mice can be very difficult to spot. For example, they can be very brief, or they can happen when the mice are not under direct observation. In humans, we use electroencephalography, or EEG, as the gold standard technique to detect and quantify seizures. So we sort of look at brain waves, if you like. And we can actually, you may be surprised to learn, do the same thing in mice with some fiddly surgeries. So what we did is we took a bunch of adult wild-type mice and a bunch of mice which were heterozygous for E122K, like patients, meaning that one copy was E122K and one copy was normal, and we performed EEG recordings on these mice. So these are the sort of brain waves that we were able to capture from mice. So you can see that they have different waveforms when the mice are awake versus when mice are in non-REM sleep or REM sleep. As we found previously, the mice were not having obvious seizures, for example, freezing or experiencing convulsions during these recordings, which wasn't a big surprise. The EEG was also mostly normal. However, we did notice some abnormalities. So the main abnormality that we noticed were these high amplitude spike trains, which occurred in the cortex of the mice. And you can see that here in this trace. These events occurred in all of the mutants tested, and they only occurred in the mutant mice, so they're definitely caused by the mutation. They occurred when mice were awake as well as when they were asleep, and they occurred on average 6 times per hour, and they lasted for just under 1 second on average. However, the mice showed no outward behavioral signs during these events when they occurred during wakefulness, and so what they think these are is electrographic seizures, which is to say seizures which can only be detected by EEG. So just to sum up, the mice have been able to help us understand the pathological mechanisms of E122K. We saw that mice were better off having no EEF1A2 at all than having E122K, which tells us that there's a toxic gain of function, and that's really important for designing therapies for E122K. And we also want to develop disease models to test therapies. Now, since these mice have relevant motor abnormalities and electrographic seizures, that tells us that they're capturing some of the pathology that's seen in patients with E122K, and that we can use these mice to test therapies in the future. All of this information and much more is available in a paper that I recently published this year. So do check it out if you want to know more about the mouse model of E122K. And then thanks very much for listening. I'd also like to thank Kathy and all the members of the Abbott group, past and present. Also, I'd like to thank Alfredo, who taught me the EEG surgery, and thank you to our funders as well.